What's up, everybody? So, my name is Jay. Um, a while back, I dropped a video with my Still's disease journey vlog, or whatever you want to call it. Um, so, dropped that video more so, speaking about the journeys with Still's disease and living with that, and then that I have that kind of under control and things of that sort. Something new comes up. So, to rewind, I go. Um, Maybe we're in 2021, so maybe I transferred from California over to Virginia. I'm in the military, so I transferred from California over to Virginia in like maybe October. And around that time, I'm playing around with my kids, and I keep having this like my hip gives out on me, like just gives out. So I'm like I'm hitting the floor when it gives out. So I'm thinking that I pulled a groin or something to that effect. And so I'm going to the doctor. I'm complaining about these things. When I first get here in October, I go to the doctor. I complain about these things, and the doctor says, "Oh, you know what? Um, we'll ignore it for now, and we'll try to figure something out later on." So fast forward, I go back to the doctor, and I say, "Hey, look, it's not getting better." This is like maybe 2 months later, so maybe November time frame. No, actually, October. I waited like almost a year, so like maybe August time frame. I go back to the doctor and I complain again. And I say, hey, I don't know what the issue is. And this time the doctor's like, she's more receptive. She's like, okay, cool, no problem. I'll put you in for physical therapy. So she puts me in for a consultation for physical therapy. I go to physical therapy. I do the exercises somewhat, but due to the COVID environment, the military was no different than any other entity. So we were pretty much shut down. So I would get one day of physical therapy a week, and then the rest of the week I was supposed to do it myself. So I go to the physical therapist for my follow up, and I let her know it's not getting better. And she says, "Okay, you know what? Let's get an X-ray." And I say, "Okay." Then she puts me in for 3 more consultations with physical therapy and the X-ray. So the day I go get my X-ray, then I head over to dental to get my braces redone, and I'm about to get on the plane to go to Las Vegas that same night. Um, And every time I go to Las Vegas, I get bad news. I found out I got sick. Well, I know I was already sick, just didn't know what was going on. But the blood test that diagnosed me with Still's disease, basically, it diagnosed me before I went to the hospital. Before I had an overnight stay in a 4-night stay in the hospital, was this blood test, and the doctors called me while I was in the airport on the way to Las Vegas to tell me that my blood results had come in, but it was nothing to worry about. My daughter wrote on me, but it was nothing to worry about. Enjoying myself, and I wound up having a Still's disease flare up, and it was like whatever, bad day. So I get a phone call from my physical therapist, who she was like, "Hey, Mr. Jefferson, did you just go get your X-ray?" And I said, "Yes, got my X-ray." And I'm thinking nothing of it. Just she's confirming that I went and did it. And she says, "Hey, cancel your 3 physical therapy appointments. Stop it immediately. I need to put you in for an expedited referral." But she doesn't tell me like what's wrong. She just says, they found some white spots on your hip. So me being me, I go to WebMD, Google, my trusty handy dandy doctors, and I search. And normally when you search white spots on hip, one of the first things that comes up is bone cancer. So I'm about to go to Vegas, get on this plane, and I see bone cancer. But I say, I'm not going to scare myself. I'm going to just let it be. It is what it is. So I go to Vegas, I relax, I'm chilling, and then the next morning I get a call because she put me in for an expedited referral, but I miss it because I'm asleep. So I miss the call, I get the message, and I do this thing when I miss a phone call, I always see who calls me. So I Google search the number to see, exactly who it was, because I don't know if you guys anybody in the military knows the base typically has dedicated extensions. So when you see the first 3 digits of a number, you typically know it's the base. Someone on base, you typically know that. But you can search it to see, okay, oh, it's the hospital calling me. Oh, it's my job. Oh, it's PSD. It's someone else. You know, it's all these things. So I typically do a search to figure out who's calling me to see if I'm going to call back. You know, it could be another number the job just got and I don't want to answer. But anyway, so when I do my search, it's the cancer department of the hospital. So now I'm like in Vegas, I'm nervous, I'm scared, you know, everything's, you know, slowing down. And I can't stop thinking like, man, I have cancer, I got cancer, I got cancer. Can't stop thinking this. So, you know, I'm in Vegas trying to enjoy myself with my wife and my, you know, my children and her parents. You know, we took the kids out to see her parents. So finally, you know, I finally get control and just relax and finally calm down. And then I start reading the notes on it, and they start talking about avascular necrosis of the femoral head, and some things were wrong, and you know, no evidence of, you know, things I didn't understand until I'm Google searching them, and not as I'm Google searching these terms, nowhere do I see cancer, so I start to feel more at ease. So when I get back, finally get in contact with the lady, I make my appointment. So I get back from Vegas, I go to my appointment. When I go to my appointment, the doc says, yeah, you know, on the x-ray, you have avascular necrosis, but I want to verify it with MRI. So, okay, cool, no problem. Which, you know, was pretty much, I figured, typically standard for the issue, I guess. But what I read online was, if you need an MRI to diagnose it, that means you're in stage 1, typically. Mine was already diagnosed in stage through X-ray. They knew I had it through an X-ray, and he just wanted to get an MRI for a clear picture to see how far it was. So I knew for a fact it was stage 2 at the very least. You know, just from what I had read and things of that sort. Doing my own, doing my own web searches and things. So I know it was stage 2. So come back, get the MRI results and things of that sort, and find out I'm stage 2, closer to 3, or whatever the case may be. Like probably in the middle of stage 2, I guess. So get that, and now I'm scheduled for core decompression. Don't know when I'm having it. Just got scheduled earlier this month, so probably sometime in February or March. Hopefully it doesn't collapse before. Yeah, so like I said, told the story earlier about the Still's disease to basically say the Still's disease, when I got sick with that, I wanted to do everything I could to not necessarily beat it, because like the doctor told me, I'm going to deal with this for the rest of my life. So not beat it, but get it, and they call it remission. So get it into remission. And with that, it took steroids, it took methotrexate, which is like a immunosuppressant. They call it a form of chemo, but immunosuppressant, whatever you want to call it. That, folic acid, pneumonia. Man, I took like, it was a point in time where I was taking like, on the average day, it was like 12 or 13 pills. But on a Friday, when I took the immunosuppressant, it turned into like 25 pills. So it was like every day I was stuffing myself with like 12, 13 pills. And then on a Friday, it turned into 25. And that was like horrible, like a horrible time in my life. I never wanted to do it. But if you don't have an autoimmune disease, or if you've never experienced what a Still's disease episode feels like, man, let me tell you, it is like one of the worst feelings you will ever feel in your life. Fevers, chills, the inability to move, like your joints stiffen up on you because your white blood cells are attacking your joints. So like your joints are swollen and stiff and you can't move. And it's not just your fingers, it's your arms, it's your legs. It would be like mornings when I would wake up in an episode and like I'm in tears because I can't move. Like you think you're like paralyzed. I don't know how to really explain it, but that's like the best way I can explain it. Like I couldn't button up my pants. Like just imagine being an adult not being able to button your pants up, not because you're swollen or you're too fat or something, but like your hands hurt that much, and putting on your pants hurt because you don't want to move. Man, it's like one of the worst feelings in the world. Point being is I never want to experience it again. So whatever the doctor said, dude, I did it. I did it because that's the type of patient I believe in the power of medicine. For long story short, fast forward to this AVN diagnosis, the typical one of the rare side effects of the side effects of the I forget the name of the steroid that I took, but it was a steroid. Prednisone. One of the rare side effects of prednisone is avascular necrosis. So imagine that. I pump myself with all this medicine for a year and a half, 2 years, and I finally get off of it, and only to find out that the medicine that was making me better from Still's disease actually affected my hip to the point to where now, at one point in my life, I'm going to need a hip replacement. But we're at this point right now. I'm only 31 years old, so yeah, I'm moving forward with the core decompression. This is like a 10, 15 minute encapsulation of everything that happened over like years. So just understand, I'm moving forward with the core decompression, and the whole purpose of this is because I wanna track my journey through this. And as I'm searching online, I can't find very many videos to track what it was like dealing with AVN, and also what it's like to have a core decompression. For everything else that I've ever had in my life, I could always find something. So for Still's disease, while there weren't a lot of videos, people giving their testimonies on Still's disease, there were like other autoimmune diseases that were similar, such as rheumatoid arthritis and other things of that sort, to where I could see and I could learn and see what was normal and what wasn't. So I want to just track my journey, basically maybe once weekly, say what I'm feeling, how my hip feels. Typically, it hurts when I shift for the most part. So when I'm like standing up, if I'm just standing straight, and then I move, to start walking, it hurts. Then, playing with my kids, it kind of hurt when I'm running and things of that sort. So that's kind of the reason why I'm doing the core decompression is, while I know it's not an end all be all or a total fix, I kind of feel like, for me personally, being so young, that hopefully if I can heal right, it can buy me at least, another 8 to 10 years with my current hip, let me finish out my military career, and then I can look into getting hip replacements and things of that sort. But for right now, I think I'm gonna do the core I am gonna do the core decompression. So, any questions or any comments or anything that you guys wish to share with me, please leave it below in the comments. Please like and share, subscribe, and please come back and watch more videos so you can follow me in my journey. Anybody else out there going through it, please ask questions, and if you've been through it before, please feel free to tell me what I can expect as far as recovery time, as far as not only recovery time, but what to expect as far as pain, as far as my family. Like, I've heard different stories from 6 to 12 weeks on crutches to all the way 6 months on crutches. So, let me know what I can expect, and thank you. Like I said at the beginning, my name is Jay, and please like, subscribe, and share this video, and enjoy your day.